All right, I would like to call to order the workshop of Lee County Board of County Commissioners. It's July 30th, 2024, and it is not 9:45. I don't know what time it is. Someone want to give me the time so I can state it for the record? Sorry? 11:55 for the record. All right. Today's topic is to propose conversion of Lee Health to private nonprofit system. I would like to recognize County Manager Dave Harner this time.
Thank you, Mr. Chair. Before we get started and I turn this over to Glenn Salyer, I would like to disclose that my son works for Holland & Knight, and Holland & Knight is currently representing Lee Health. He is not an attorney. He does work in the marketing department, but I felt it was important to disclose that, and I'd like to turn it over to Mr. Wesh.
Mr. Chairman? Yes, sir. By way of similar disclosure, I would just like to point out that my wife is currently employed by the Millennium Physicians Group, which is one of the for-profit entities identified in the Lee Health study as a potential competitor. I do not believe that either my situation or Mr. Harner's constitutes a legal conflict of interest under Florida law. But in the area of transparency, we just wanted to lay that out there so that all parties were aware. We had previously made Lee Health staff aware of those two factors in our meetings that we held last week, and we just want to place it on the record for the benefit of the public and transparency. So, thank you.
Thank you.
I have a question. Yes. So, for full disclosure, so you both are saying you have some type of conflict in this issue before us that was brought upon us by the state of Florida, correct?
Mr. Chairman?
Yes, please.
Do you feel comfortable working representing the Board of County Commissioners this issue?
I do, yes, sir. My wife is not in a policy-making role or a policy-making level with Millennium Health, and I do not believe it has any impact on my ability to represent the Board of County Commissioners or the public interest in this regard.
Same for me, Commissioner. My son is on the marketing department, not an attorney. Okay.
Save it for later.
Okay. So with that being said, we're going to have Glenn Salyer present for Lee County, and then Michael Nachaff and his team will represent and present for Lee Health. So, Glenn?
Okay. Thank you. Good morning, Commissioners. Is this, can you hear me well? Okay, very good. Thank you. I do want to, before we get started, just recognize that obviously we have Lee Health executive team members here, Chief Legal Officer and staff, outside counsel. I believe Dr. Antonucci and Michael Nachaff will introduce them as appropriate through the proceedings. So I do just want to introduce Craig Smith by name. He is with Hogan Lovells. He is the outside counsel engaged on behalf of Lee County to help with this issue. If you can raise your hand, Craig, commissioners, you may want to ask questions of him during the workshop. So I know it's been a long morning. I will move fairly quickly through our part of the presentation. We just want to frame up for everyone the county's roles in this process. And so our agenda overall will consist of that quick introduction that really does delineate the county's role in this process. Then we will move to Lee Health's presentation. Following that, we'll come back to county staff to talk a little bit about some issues around a proposed conversion agreement. And then finally, as we always do, we will have board discussion and you can provide direction. And so we typically pose these questions at the outset so that people can be thinking about them as we move through the material. One of the first questions that staff is asking of the board is, do you want us to work with Lee Health staff to craft a conversion agreement for future consideration? And then secondly, if the answer to that question is yes, should we schedule a special meeting in October to consider approval of that agreement? And we'll talk about why that might be beneficial in just a few minutes. And then finally, of course, what additional input and direction does the Board of County Commissioners want to provide to its staff? So for an overview of the county's roles in this process, pre-conversion, under the Enabling Act as amended, Lee Health's Enabling Act as amended by House Bill 227 that was passed by the state legislature in 2023, our primary role is to come to an agreement with Lee Health that ensures continued programs and services that are currently being provided continue into the future. And I would say the biggest component of that is ensuring the continued mission of Lee Health's safety net service mission. And so we'll talk about the agreement a little bit more in just a moment. And then post-conversion, as a party to that agreement, the county's role would be to monitor compliance with the covenants in that agreement and then ultimately enforce those covenants should it be necessary moving forward. I think I see it.
Commissioner Wayne.
Question, just clarification for the record. When is that 20 days? When was the start of that? When's the end? So what's the time?
Let me jump to that, Commissioner. I can answer your question with this slide. So on June 13th, the Lee Health Board made a determination that conversion to a nonprofit, private nonprofit, is in the best interest of Lee County's residents, and that triggered the 120-day process. So that takes us to October 11, which would be the last day that this matter could be considered under the statutory timeline for this cycle. And if you want me to stay here, we can talk about what that means right now, or I can come back to it.
Follow-up question. When did we get official notice from Lee Health to do this? To entertain the conversion. So that was June 13th they passed this.
Yes,
when
sir.
Did they ask us?
I'm not sure I know the answer to that question. You mean in terms of notification to our chair or something?
So just again, the 13th, their board passed this to obviously move forward. When did we get official notification?
Well,
Our role would be what we're going to do.
I mean, we knew that very day, but I would look to the chairman's office. I don't know about a formal notification.
Yeah, we just discussed it, right? So we would need to look up the date to give you exact time.
I was just curious.
Right.
The odd, obviously for the record, the odd time is obviously when we went on break. So I'm just trying to understand what period of time as a body we had.
Yes, sir.
Okay, that's all.
I have a question on that topic since it was asked. So they voted, my question is, and obviously, obviously, I think Lee Health is one of the most important services that we have in our community. They have the great staff and the greatest resource we have in the community. But my concern is how we got here today is I wish we'd had this conversation a year ago when this board went up to House bill, because we never got approached. And this is the first public meeting we have on this, and that's why I'm really concerned about this whole process, because we should have been approached before they voted on June 13th. I wish their board would have met with us. We had a workshop with their board to talk about this, because we're included in something to be involved in, and we had no communication. And that's why I sent an email to my county management staff that I identified earlier on July 22nd, last week, saying I'm concerned with the lack of information and communication to the Board of County Commissioners for the scheduled item on the July 30th related to the health agreement. Myself and other board members are currently out of town, scheduled to work related conferences, or will be absent for the meeting on the 30th. We only have 4 here today. Also, per administrative code, there's been no board acts discussion publicly to bring this action forward. Why was this placed on the agenda without board direction? Question mark. I suggest that we bring the item back up in a staff public meeting and let the board provide direction and advertise as a provided agenda item. So here we are today. The meeting was not delayed. So that was my concern, was when do we get notified by the June 13th meeting? Were we notified before that, or?
Mike.
So Glenn, on that last slide, if you go back to the slide you're on before, slide number 4. Post-conversion, monitoring enforcement. Who would be providing the monitoring enforcement?
So Lee County, as a party to the agreement, would presumably need to monitor compliance and then enforce covenants as needed.
Who would? Lee County?
Lee County.
So we're having the meeting today. Okay, and how would you provide enforcement? How would we provide enforcement?
There's a proposal that Lee Health has made that I think they will go into in some depth during their presentation. There are some options that staff has considered potentially for your consideration that we can talk about whenever you prefer. But ultimately, we would have to come up with a monitoring mechanism that the county controls in some form or fashion.
Do you know why maybe the state didn't include the Department of Health or another state agency that are already receiving the receivership and funding going back to the hospital in the first place, since Lee Board of County Commissioners has no involvement now currently in health?
No, sir, I don't know why a state agency wasn't inserted into the process. It might be that Michael or someone else could provide some insight.
Thank you.
Also, before we go any further, let's make sure we turn our mics on and off. That way we can hear the questions and also hear. You did great, but I think we didn't quite hear Kevin's. So make sure we're doing it. Thank you, Mr. Chair. All right. Back to you, Glenn.
Okay, very good. And then I do want to point out that one issue not mandated by the legislation that as a practical matter we would be involved in is the creation of a Lee County Local Provider Participation Fund, and we'll touch on that briefly in just a minute as well. So the primary elements of the conversion agreement required by the legislation, the biggest component of that is, and I'm just going to read this, an enforceable commitment that programs and services provided by Lee Memorial Health System will continue to be provided to residents of Lee County in perpetuity unless otherwise agreed to by the two parties. And then there are a list of things here that can also be, either have to be or can be included in such an agreement. And then back to the timeline and to pick up with Commissioner Ruane's question. If we back into the timeline in which we need to act under the statute, what we end up with is, as currently slated, the Board of County Commissioners would only have a single regular meeting between now and the time that the agreement needs to be published. So under the Enabling Act as amended, the definitive agreement to be considered by both parties has to be published 45 days before it can be approved. And so backing into the calendar, that gives us August 17th. You only have one regularly scheduled board meeting between now and then. That's August 6th. So if your answer to the question, if you're going to direct staff to work to craft an agreement for your consideration, we would suggest that we call a meeting on October 8th for ultimate consideration to adopt that agreement so that we can have one more regularly scheduled board meeting before the agreement would have to be published. And that would be your August 20th board meeting.
I have a question. Where's the schedule of the state dropped on this? Is there options if the schedule is not met? Does that clock start ticking again another 120 days?
I'm not sure if I understand the question, Commissioner. I think
if the timeline is not met, what is their next step beyond that?
Oh, I understand. If we don't ultimately come to an agreement, then the district would continue as it is now. And you may be asking if the process could be restarted. And if you're asking that question, I probably would ask our county attorney to weigh in.
Richard? Yes, sir. Richard? Commissioners, in terms of timeline, just to take a step back, what's driving this is the October 11th deadline, is the 120-day period called for in the special act that's driving this entire process. That 120 days started when the Lee Memorial Health System found the proposition to be in the public interest. That took place on June 13th. So the 120 days ran from June 13th, which gets us to the October 11th time frame. What further complicates the matter is the legislation also requires the agreement to be published 45 days before final adoption by the BoCC and the Lee Memorial Health System. That's how you get back to the August 17th timeframe. In answer to the direct question, the legislation is very specific in terms of the timeframes that we've discussed so far today, the 120-day response time and the 45-day publication time. The legislation is silent, however, as to the number of times this process can be commenced. So I believe a fair reading of the statute in its entirety would lead to the conclusion that in the event the parties cannot agree to the agreement contemplated by the statute by October 11th, the process could be restarted. That process would have to be restarted, however, from the very first aspect, which in theory would require Lee Memorial to update their feasibility study and then their board to make a new finding. It would start the entire process over. I don't think you can just extend the 120-day time period. So once you're within the process, you're bound by the statutory timeframes, but there's not a limitation on the number of times the process can be gone through.
Has this been done in other areas of the state of Florida with any other hospital systems?
Mr. Chairman? Not to our knowledge. This is a case of first impression here in Lee County.
And Craig Smith here, our outside counsel, has he done that work anywhere else in the country or anywhere else in the state?
He has done conversion work, but this is the first time we have talked about a conversion from a public entity to a private not-for-profit. If you've got further...
That's correct. In Florida.
In Florida.
Would be easy to just have them sit at the desk.
Yeah, I think so. Yeah. Could you come on up and actually have a chair so we can address you directly, I think, instead of in the crowd?
Craig, since you're here, you turn the mic on, push the little red button, it should turn green.
Yes.
Have you dealt with this timeline before, any conversions in the state or Florida or the country like this, or is this only one you were done like this?
Mr. Commissioner, as Richard indicated, this is a first impression in Florida. There have been examples of a conversion of a public district type entity to a not-for-profit in other states. But in terms of Florida, this is a first impression. And in terms of this particular timeline, I think Lee Health's representatives can tell you how the legislature arrived at that particular timeline, but it's not something that is a precedent in Florida.
Okay, thank you.
Okay, thank you, Mr. Chairman. So just to wrap up the overview framework of the county's roles, we'll talk about the Lee County Local Provider Participation Fund. I do want to note here that this is potentially something that the county could be asked to do whether or not Lee Health ultimately converts. They are not the only eligible provider that could benefit from such a fund, and so we just want to note that at the outset. 17 counties do this already. The Board of County Commissioners would need to adopt an enabling ordinance, and then we would work with the eligible providers to essentially set voluntary non-ad valorem assessments against their real property. Those funds would be collected and ultimately transferred through intergovernmental transfer to the Agency for Healthcare Administration. Those funds then get paired with other state matching funds, and ultimately the federal government provides additional supplemental funding that gets redistributed to the providers. And the reason for all of that is I think everyone is aware that in the Medicaid world especially, there's a shortfall in terms of how much the providers get reimbursed for the services versus their cost. And it fluctuates every year. I think the statistics I've seen recently say it's typically between 60 and 65% reimbursement. And with these supplemental funds that can come from the federal government, it can help close that gap and get providers closer to 80% reimbursement. Now, just by way of illustration, and this will be the last slide of the introduction, we're going to use the direct payment program as our example. There are other federal supplemental revenue streams that the fund could participate in, but just as a really high-level overview, you can see here the voluntary assessments would be levied, the hospitals would pay them, it goes into the fund, like I said, ultimately intergovernmental transfer to ACA, and then ultimately the money comes back from the federal government, redistributed to the providers. And with that, I think we will just ask the Commission if there are any questions regarding our role in the process, remembering that we'll come back to you after Lee Health's presentation for a more substantive discussion. Then with that, I believe Dr. Antonucci will lead the way for Lee Health. Is that correct? Okay. Yes, sir. Take it away.
Thank you so much. I want to just take this opportunity to thank the County Commission and their staff for the incredible work that's been done and will continue to be done as we address this very important issue in this community, and that's the future of healthcare and healthcare delivery, and what will be in the best interests of the citizens of this community. Been for over 100 years. That's really what this is about. And we'll share with you the work that we've done. We'll share with you how we got here. Michael will talk about the legislative process that got us to this point. We'll talk about the 10-month process that we've been through, including a 6-month evaluation by an independent third party, assessment by our own leadership team, and an assessment, of course, by our board of directors. And again, we want to thank you in advance for your great work. So we need to know where we've been so we can talk about where we're going. As I mentioned, Lee Health has been proudly independent, it's been nonprofit, and it's been self-supporting since 1916. We have a local mission, but we clearly have a regional impact. We have been and want to be continually locally led and governed. We have been a critical safety net for this community, meaning we take care of anyone regardless of their ability to pay. And what's so critical about what we're talking about is how do we maintain that, how do we continue to do that into the future. We provide the widest array of care that we'll talk a little bit more about later. We are among the largest public health systems in the U.S. and in the state of Florida. And in fact, we are the largest public system that does not have taxing authority. Most public systems our size have taxing authority to support their safety net mission. I'd like to continue that. We are the top employer in Lee County. We've been a trusted provider for many years, guiding this community through natural disasters, global pandemics, and we are the trusted source of healthcare information in our community. We are clearly the largest economic engine in our community. This will be a matter of record, and I won't go into all of this, but just within the next few years, the things that we plan on doing in this community are going to generate significant economic benefit to this community. I want to focus on two items on the right side, and that's the 30,000 plus jobs that either directly or indirectly are related to the work that we do, representing 10% of Lee County's total employment and total earnings. A healthy Lee Health, a vibrant Lee Health, is critical to a healthy Lee County. There are clouds on the healthcare horizon. Many of you have seen these. There are significant pressures that we are facing, and we want to evaluate ways that we can stay local, stay under local control, and continue that safety net mission. And that's really what this is about. We're seeing significant increases in supplies and labor brought on not only by the pandemic,
by significant shortages of healthcare workers. We know that Medicaid and Medicare reimbursement does not keep up with increased cost. 75% of our business is Medicare and Medicaid does not cover the cost of care. That's borne entirely on the privately insured, that differential. And whatever's left over is what we reinvest in the community, upwards of $150, $160 million a year, in addition to at least that much in community benefit that we have been providing for this community. We're seeing many health systems operating at a loss. We're seeing a surge of disruptors, ones that are obvious to us, for-profit health systems that are planting their flag here in Lee County. But others, CVS, Amazon, private equity companies coming in and buying large physician groups in our community. We're seeing a rise in consumerism, a significant increase in the need for technology, artificial intelligence. All these things are going to be critical parts of the healthcare landscape moving forward. We're seeing a shift to value-based care, which is a different way to deliver care and a different way to get reimbursed. And we're seeing significant nurse and physician burnout. In fact, it's not only involving physicians and nurses, it's involving everyone who works in the healthcare sector. To our Vice President of Government Relations, Mike Nachiff, who's going to take you through a history of how we got where we are today and why we're asking you to help us move this health system forward.
For to answer some of the questions that have been asked. So you know that Lee Health started in 1916. There's a great history about that in the old county courthouse that we came over from next door. When the original Lee Memorial Hospital was built on Victoria and Grand, we were a community-focused nonprofit then, a private nonprofit. In 1968, we began operating as an independent special health care district created by the Florida legislature and governed by the board of directors. In the 1970s through today, we've been experiencing rapid growth, certainly along with Lee County. And some factors changed in 2019 that lead us here to you today. In 2019, the Certificate of Need was repealed. The Certificate of Need was a law on the books in Florida and other states that prevented the overproliferation of healthcare facilities. It let you know what you could build and where you could build it based on the need determined by the State Department of Health. When that was repealed, private, for-profit or not-for-profit institutions could build hospitals and healthcare institutions anywhere, but the public districts could not. They were bound by a geographic boundary. But what's more, something else that happened that year, Halifax Hospital versus state. The Florida State Supreme Court made a decision limiting all independent special hospital district authority. So in that ruling, what they said is if you do not have explicit written authority to act, you cannot act. The original Enabling Act was written in 1968. It was updated 12 times between 68 and 2000. Telehealth has come around since then. Mobile units have come around since then. There's a lot of things that are not explicitly written in Lee Health's authority that we would need authority to do today. So in 2020, through last year, we went back to the Florida legislature seeking changes, and I'll explain that more on the next slide. In 2020 through 2022, after the repeal of Certificate of Need, we saw 65 new hospitals announced for being built in the state of Florida. And in 2023, recognizing the uphill climb, the legislature did establish a process and timeline to evaluate the structure. Our commitment remains to our safety net mission, and we will continue our local leadership and independence. That is unwavering. The legislative history and the public policy shift, helping understand how we got here and why this process looks the way it does. In 2020, with House Bill 1301 with Representative Rodriguez, we sought to expand the geographic boundary of Lee Health as a special district. That bill was not heard by the legislature in 2020. In 2021, with House Bill 243 with Representative Roach, we sought to eliminate the border of Lee Health Special District and continue to operate as a public district. There are 28 independent special hospital districts in the state of Florida. They all have different governing authority. The current legislature dictates what authority they will or will not expand in that instance, and that's why you seek these changes through the legislature. In 2022, the legislature, when we went back to them with a third local bill, after working with the delegation and getting it through the delegation 3 times, the legislature said we are disinclined to hear the bill in this form. We have an idea. It mirrors a historical process, as a matter of fact. A dependent special district in Tampa that did convert from a public district to a private nonprofit. That's Tampa General Hospital. Occurred in 1997. That process had to be recodified in the law because, as you heard me say, in 2019, Florida Supreme Court said unless it's explicitly written, you can't do it. So they had to recreate the authority. But the timeline mirrors another area of Florida statute. Chapter 15540. The timeline looks a lot like it. It's not exactly the same, but that's what the staff borrowed from the writer. So if you're interested as to why you see 160, 120, 120, it looks a lot like what it looks like in statute. That authority has existed for quite some time and required the same level of responsibility out of the county if you were to sell Lee Health. In 2023, after the governor had vetoed the original bill, Senate Bill 1260 and House Bill 897 that passed the legislature, he said in that veto message, the authority is okay, but all of these changes need to be done on a district-by-district basis. There's 28 of these districts. All the changes have to look different for each one. So in 2023, those same changes were refiled as a local bill, House Bill 227. That permissive conversion authority for Lee Health was passed by the legislature and signed by the governor. You can see from the public policy shift perspective, at one time there were more than 80 public hospital districts that existed in Florida. Today there are 28. The legislature directed the preferred public policy to achieve the desired outcome. Their intent is to have less government. They're disinclined against having a sovereign immune taxing district, even though it doesn't collect a tax. It's the largest public district in the state that doesn't collect a tax, or in the United States. And the direction was based on historical precedent and desire to limit government while maintaining the services. Real brief on the timeline. This began on August 31st of 2023 with a vote by the Lee Health Board of Directors to evaluate the conversion. Kaufman Hall was brought on in that period of time. They took 6 months, 180 days to conduct a study. They published the study in February of 2024. When that study was published, in between the numerous meetings that you'll hear more about from our Chief Legal Counsel, who's going to be up soon, we had a number of public workshops, public hearings. We put this on display, invited commentary in from the public. We have a website that has received more than 50 questions and answers, and this process has been available the entire way. After the third-party report was received in February, the Board of Directors had an additional 4 months to make a discernment. In those 4 months, they conducted a second public hearing, which was not required by the enabling legislation. They had more workshops with the Lee Health Board of Directors, and they invited the public in further. That process concluded on June 13th of 2024 when they voted. When they voted, they set us into this last phase, the 120 days that is anticipated to conclude by October 11th, as you heard by your staff. In that timeline, we're looking to finalize the terms for a mission agreement with the county, and at the end, we'll be voting to either the Lee Health Board of Directors and the Lee County Board of County Commissioners are going to be voting to accept or reject the terms that are negotiated. And with that, I'd like to invite up Mary McGillicuddy, our Chief Legal Counsel.
My vertigo is kicking in a little bit here. The pattern on the floor. Sorry. I made it to the podium. Yay. Good afternoon. It's a pleasure to join you today. Thank you for inviting us to be with you. I can't speak as fast as Michael, but I will try to go through these slides and not spend too much time on them. As Michael indicated on the timeline slide, October 31st of 2023 is when our Lee Health Board initiated their vote to trigger the evaluation of the benefits to the residents of Lee County of converting a unit of government to a community-focused nonprofit. Following that, we engaged Kaufman Hall, an independent third party, to to actually conduct that evaluation. And then as a next step to engaging Kaufman Hall, our board then began its due diligence. And so my part of the presentation is to share with you the due diligence that our board has undertaken, the Lee Health Board has undertaken. I think this slide, let me back up just 1 second. The board, we also engaged the Holland Knight Law Firm, as you heard about earlier, to assist our board, along with George Knott and myself and our in-house team. So we had a good team effort to support the board's efforts to commence its due diligence, which began soon after Kaufman Hall started their work. This slide is a good overview. It's just a snapshot of the tremendous amount of work that's been going on in the last 10 or 11 months. You can see lots of efforts to communicate with physicians, with employees, and with our community, as well as a number of special meetings and workshops that were held by our board. So I'm just going to summarize those for you. In the physician engagement area, there were 20 different separate engagements, including town halls and meetings with our lead physician group, as well as the medical staff. There were 13 different sessions with members of our staff. All levels of the staff were engaged in conversations, answering questions, getting input. There were 6 community town halls sponsored by the Lee Health Board in each of the 5 districts for our board members. And there were 11 public special meetings or workshops held by our Lee Health Board that included the receiving of the report from Kaufman Hall, as well as various governance discussions, which I'm going to get into a little bit more in the other slides. There were also 2 public hearings, one in January of this year and another in April, and then multiple other engagements that are just too numerous to list. But the idea is that we were in the community, talking with the community, listening to the community, and getting their feedback. And then Michael spoke about the website, so I won't reiterate that. And so again, I won't go. This is in your packet. I assume you've reviewed it. But I do just want to hit some points about what was discussed at all of these special meetings and workshops. Again, this is the Lee Health Board's due diligence process. And that began in November with November 7th and November 13th workshops. These included discussions about our board having to understand, they understood what it's like to be a board of a public hospital district. What does that look like as a Florida nonprofit under Chapter 617? What do those duties and responsibilities look like? And some of them are similar, and then there's others that are not. And so our board went through a process of understanding the distinction, understanding what it's like to be a 501c3 governed by the IRS. And although as a public hospital, we do have that and responsibilities of a nonprofit board as regulated by federal and state law. The initial considerations included the mission, vision, and values of the successor organization with the underpinning of wanting to retain the public mission. The composition of the initial board of directors of the successor entity, as well as compensation of successor entity directors. And those items are covered in the enabling legislation amendments governing conversion. At the November 17th board meeting, the board approved the mission, vision, values for the successor nonprofit, which mirror the mission, vision, values of the public hospital board and system. Board member composition was, they voted that the Lee Health Board of Directors in place at the time of the final vote on conversion would serve as the initial board of directors for the successor nonprofit corporation, obviously subject to each board member's preference. And then compensation would be the initial nonprofit corporation's compensation. The board of directors would be eligible for compensation in the same manner that they currently are provided in the public enabling legislation. Again, subject to the board member could decline it. So that vote took place on November 17th. And then January, we had another workshop to review what articles of incorporation and bylaws and policies and procedures would look like, the articles of incorporation for the new entity. This is important because this is where you'll find the answers to some of the questions you all might have today or in the future about what this new entity would look like and how it would operate. Again, February 8th, there was a workshop that included the conversion case studies of 2 health systems, not in Florida, and then Tampa General. And again, more work on the Articles of Incorporation, the bylaws, and the mission agreement. And the mission agreement is the document where the enforceable promises reside. The Kaufman Hall report was shared with the board on February 15th, and there was a follow-up workshop on February 29th where Kaufman Hall came back to answer questions that the board members had. March the 5th, another workshop on the same topics. And then March 14th, again, working through the same Articles of Incorporation and bylaws and the mission agreement. April 11th, there was a special meeting that was led by Dr. Antonucci, and that's where he shared the recommendations of Dr. Antonucci as well as the senior leaders and the leadership. On the 18th, Ben Spence, the Chief Financial and Business Services Officer, also provided input to the board as to the financial impact of a conversion, and Ben Spence is going to be talking to you in a few minutes, so I won't go into any of those details. And then again, Larry followed up with what the path forward would look like. Also at that same meeting, there was a robust discussion about the mission agreement programs and services that will be contained in the mission agreement. And those are listed there, and I think they're going to be discussed later as well, so I won't go into that detail. And again, this is May 16th, May 30th, meetings that again led to the June 13th meeting, the special meeting that you heard about earlier, we're discussing earlier, and that's where the Lee Health Board determined that conversion is in the best interest of the Lee County residents. And with that, I will turn it over to Ben Spence. Not as fast as talking as Michael, but I tried to keep it moving along.
Thank you, Mary. Good afternoon. Economics of healthcare and how this conversion will impact us financially, what it would look like under the status quo. We're going to look at a couple of different projections. And I think it's important to understand, unlike a for-profit entity who is in business to make money and increase shareholder wealth, Lee Health as a not-for-profit is in the business to empower healthier lives. That is our mission. It's what we do every day, and it's what we want to continue doing for many, many years to come, hundreds and hundreds of years down the road. But in order to do that, we have to look at the best strategies forward, and that's why we're bringing this forward to you today. I wanted to walk you through the number of assumptions that we have to make in healthcare. Healthcare finances is very challenging. It's complex. It's messed up in the United States for sure because of the payer system. It's difficult to navigate. It's difficult to succeed and to provide care to your lower income populations while also trying to provide it for the entire community. So what we look at when we look at financial projections for our health system, and that I look at when we're estimating the financial results, one is the population. And in this county and in Florida in general, of course, we've had population growth. We're an attraction, not only for seniors anymore, but for businesses throughout the country. They're coming to Florida faster than we can keep up with them in many times. The inpatient usage then we look at as a relationship to the number of people that are moving in, the total population growth, and what is that inpatient use rate? And what we're seeing nationwide is a decline in use rates for inpatient services as it's shifting more to hospital outpatient and to freestanding outpatient services. But in our area, again, that's a little bit challenged because we have an aging population as well. And we know nationwide the number of seniors we're going to have over the next 40 years is going to grow 50%, from 63 million to 93 million people. And they use the hospital more, right? We know that. The older you get, the more services you need. And we need to be there for our seniors. We need to be there for our young families from the time they're born all the way through their life cycle to give them the highest quality of life that they could possibly have. And we believe that that's possible through empowering healthier lives and providing the best services. The Hospital at Home program, as we look at ways to lower our overall cost of capital, we know that beds are really expensive right now Construction costs have grown exponentially. And so we're looking at hospital-to-home program that will help us to serve more while at the same time lowering our capital costs. One of the trends that we look at also is the impact of the competitive landscape in Lee County. And we know we're an attraction for many health systems, and we know some are coming in. We know that HCA is planning to build a 100-bed hospital in our area. We don't know exactly when, but we know that when they do, that's going to cost. It's going to come out of Lee Health's population that we're serving, and we estimate, early on it would probably cost $35 to $45 million a year. That will shift immediately. And this is because anybody could come into our county. There are no more restrictions. There's no more certificate of need. Anybody could come anytime they want and do whatever they want with very little limitations. Whereas we cannot. We can't go outside of Lee County. By our enabling legislation, we are restricted to our current borders. And that puts us at a significant disadvantage. When you look at our Lee Memorial strategy, we have a hospital that's at end of life. And when we are very excited to be building a new campus at Challenger and Winkler and Colonial, $650 million we're going to be investing in this county to continue providing state-of-the-art inpatient care as well as ambulatory care. This will be a campus that has more ambulatory than it does inpatient, but it's going to be a great new addition. And we know that ambulatory surgery is going to continue to grow. We're going to invest in those. This is where we want to be able to make care more affordable where we can and do it safely. Freestanding ambulatory surgery centers offer that opportunity, and we need to be in that business. And so we forecast this in our model of how we want to grow. The second section, the second column, as you look at it, really speaks to the reimbursement that we have to deal with. And there's a lot of challenges in healthcare reimbursement, much of which is because 50% of our business is Medicare. And Medicare is scheduled to run out of money at a certain point in the future. And that's because more people are coming onto the rolls. It costs a lot of money. And unless you raise taxes or reduce the eligibility, it's difficult. Commercial payer mix is evolving all the time as well, and we have to deal with this. The commercial business essentially funds all of the losses that we have on our uninsured, on our Medicaid business. You heard we get paid about 65 cents on the dollar on Medicaid, and it's not a whole lot better on Medicare. We get about 85%. So we factor all of these things in, and the reality is we know going forward we're going to continue seeing a lot of Medicare patients, and this commercial mix may shift away from the health systems more and more into freestanding centers, and that's why we feel it's necessary to be in that business as well. We also have contract labor that's been extremely high cost. The cost of nursing, we had shortages during COVID that ran 3 years where nationwide we had shortages in labor that we had to supplement with contract labor. It went up to $150 an hour for a nurse, and our costs for the year were $165 million on contract labor. These are some of the pressures we're facing. Fortunately, that's coming down now as we're getting back to some normalcy. But we have to factor in our investment income. The case mix index is the level of severity of our patients that is increasingly growing more intense. The average hourly rate increases. We have to keep up with a good wage for our employees. So we've raised the minimum, and we continue to do that in these areas that are at the lower end but are in high demand and very technical. Look at surgical techs and sterile processing department. These jobs are competing with Target and Walmart that pay equally as much for less complex work in many cases. So we also factor in the capital investments, which I mentioned, just the one project is $650 million, but we have over $1 billion that we're planning to invest in Lee County over the next 5 years. And this is to continue to meet the needs and the growing needs, which is always the challenge. How can you create the access needed to provide you with the necessary care when you need it at the right time and place and at the best cost that we could possibly do that in? Labor productivity continues to be a model, an area of assumption that we have to tweak. And we know that automation is helping. Artificial intelligence, the digital transformation that we're going through certainly helps. That comes with a cost too. Right? We can become more productive and we have more IT costs, and you probably experienced this in your own business. And inflation and long-term debt are some other models, some other assumptions that are in our model. So factoring all of these things in, we know that we're not going to get them all right, but can we come close? And historically, we have. We've done a really good job of projecting the future. Even though the future is uncertain and there's a lot of assumptions, we lay it out there with the best facts we have, things that we know and things that we have to assume. And this is what we come up with. We come up with two models, and in my seat I had to look and say, well, are we going to be better off financially under conversion, or are we going to be better off under the status quo? We've done well for over 108 years. You heard, we've maintained without having any tax support. We have a strong financial foundation. So status quo, to some could sound good. But the reality is, sticking with the status quo, with the challenges that we face and the assumptions that we have, the headwinds that we're facing, will eventually lead to losses in approximately 2030. We would break even at best. And this is because reimbursements are not keeping up with costs. This is because it's expensive to run healthcare. Sure.
I'm sorry. Ben, if I could, I'm sorry. I know you have a lot of information. I just had a question. Why do you show such a decline and decrease? And what's our current margin now? And why do you show such a decrease in revenue over the next 5-year projection?
Yeah, the biggest impact is the 2028 and 2029. And this is the gain from operations. So this is revenue minus expenses, of operating our business. And in 2028, we anticipate that at the time, that's when we anticipated that HCA would open their new beds. So whether it's 28 or 29, we know that there's going to be a significant chunk coming out.
How many beds are you currently going to be having, and how many are you committing to the new Challenger site?
We are planning up to 168 beds in phase 1 of Challenger, and there will be also ambulatory services that will have a 8 OR surgery center embedded in the medical office building. And also the move to hospital at home is going to help because we anticipate anywhere from 50 to 100 average daily census.
Is this because you see the lack of being able to go outside the county to do business, or you're limited to only Lee County? Is that why you see a decrease based upon the beds and usage and care? Because as far as supplies, employment, we do the same thing here at the county. So when things go up for you guys, we're buying the same paper, we're buying the same stuff. Obviously, we're not buying medical supplies, but we are buying it for our EMS staff. So we deal with this every year in our CIP as far as increase of budget for everything we buy, employee statuses and stuff. And you're going back, you mentioned COVID. I know you guys, we were approached about that. You did some buyouts, retirements during COVID because the rooms were not being used for elective surgery. So we can go back and talk about that. There's no need to talk about the future. But for the future, do you see that because of the loss of beds, because of competition coming in Lee County? That's what I'm hearing from some of your doctors in-house today. That's what the concern is, because you're limited. You can't go outside the county. Some of your speakers this morning talked about the county line restrictions. So is that because of the decrease? Is that showing that?
The 168 beds was planned before we even had the enabling legislation changed. That was going to be the number at the max. And the reason was because we saw the trends in healthcare moving more towards outpatient, moving more towards ambulatory, and knowing there would be some new competition in Lee County. HCA is the first to announce, but there may be others as well. So we didn't want to be overly invested in one segment of the business while missing out on all the ambulatory expansion that we could do as well.
Remember, the county overall the last 10 years, we've been supportive, all of us, and
yes,
the guys before me here, we're always supportive. We wanted you to, we remember we went through the whole meetings of going, we need more beds in Estero and Coconut, and Bonita, we need more rooms, we need more rooms out east, maybe in Lehigh getting taken over. So we've always been supportive of the hospital expansion in Lee County. So we'll talk more about that. I guess I'll talk to Michael or Dr. Antucci about the history of the 2020 bill, 2021, to find out how we can help you guys get across that line restrictions. It sounds like that's your downside economically, not be able to expand outside, so to replace that loss of share of revenue.
Yeah, this is the piece within Lee County. You'll see in 2027, 2028, where we see competition coming in that is HCA specific. But the growth opportunity is going to be limited within Lee County. So the longer-term growth projections on revenue are going to be beyond Lee County. It will be Lee County, yes, we will continue to grow, but the greater opportunity, which I'll show you on the next slide, I think it would probably help if I could move on to the next slide. But this is just a contrast, status quo, doing things the way we've always done them. This is where we will move. And the gain from ops under conversion and through optimization of the system will bring you this steady margin somewhere around $150 million per year, which is really what we need to be able to reinvest appropriately in the community. The operating margin is just the percentage of your gain from operations divided by your net operating revenue or your reimbursement. And that shows we've run about 5%. In the conversion model, we still show we're going to drop to 3% because we need to be conservative. We need to look at some upside, but also the reality is the headwinds are still very real on reimbursement rates, on Medicare, on the uninsured, on Medicaid. But you could see the margins steadily declining under the status quo model. But the big difference in the conversion model, and this is the opportunity I think you have to think of as I did, is there greater opportunity for growth if you are not limited to Lee County, or if you are? And I think it's pretty obvious, of course, you can grow more, and outside the public domain, you can enter into partnerships, you can joint venture, you can do a lot more things that can grow revenue that we are constrained by today. So when we looked at the longer term, really starting in 2030 to 2034, that's where you see the significant growth in revenue. And it's not that much as a percentage, it's really 1%. 1% a year. Can we do that based on our ability to grow? I think we absolutely can. Probably could do a lot more than that, and depending on the opportunities that come your way. But conservatively, that's a $34.5 billion baseline goes to $35.5 billion. So it's $1 billion in new money. That is conservative, and it is the reason that it helps really fund the long-term mission of the organization. To be able to continue doing what we're doing, we have to find new ways to grow our revenue, and that is going to be constrained under the current model and with the current parameters that we have to live within as a public entity and with the border restrictions that we have, as we're pressured by all sides of people trying to come in and grab a piece of the revenues. So that's, the less dependence on federal subsidies is another advantage. We have significant subsidies that we talked about. You would have to help us with those through the intergovernmental transfer of funds to keep drawing down supplemental funds that helps us fund the uninsured, but also and the losses on Medicaid. And that's going to continue, but there's going to be less of it. So it does wean you a bit from the dependency because we can grow in new ways, and that's a good thing for the federal deficit and other things like that. So it also gives us greater opportunity to grow and scale the services regionally. So if you can scale, a lot of the times the way you can make more margin is through scale. And that's a huge opportunity for new joint ventures. You think about supply costs. If you could do it in a larger scale with others, you could lower your costs. So that's it in a nutshell. And the reason I personally came to the conclusion that we are definitely better off to go into a conversion model where we can be private, not-for-profit, and continue to serve the needs for the indefinite future. So with that, I will pass it back over.
Thank you, Ben. So after 6-month evaluation by an independent third party, after recommending conversion, after assessment by our leadership team, and our chief financial officer recommending conversion, our board then had to sit and contemplate what is in the best interest of our health system and our community. And here's why we think and truly believe that conversion makes sense. Because it will solidify our financial sustainability without any burden to the taxpayer, which is the way it's been for over 100 years. The maintenance of local control is very important to us. Lee Health is not for sale. There's been a narrative out there that somehow conversion is a mechanism that it'd be easier to sell the system to a third party. I would argue that the opposite is true. We will be less attractive after conversion when we have a binding agreement holding us to maintain safety net care forever. That is not attractive to a for-profit health system. They are not interested in providing safety net care. They're interested in improving shareholder value. That's what they do. In fact, our board of directors could sell our system today. So this will make us less attractive to any type of sale and any type of change in that way. The maintenance of safety net status is, again, critical to what we're doing. It's critical to our mission, and it's what we want to maintain forever. Our ability to expand, you've heard a lot about this, expand access, to bring services where the patients are. We discovered in this analysis that 20% of our patients actually come from outside of Lee County. We will now have the ability to put satellites in those communities and provide care closer to home for these patients. I can't overstate the importance of the ability to partner with physicians, to partner with other organizations to improve quality, care coordination, and also boost retention. That is a very cumbersome process for us as a public entity. And we know that the future is going to be in the outpatient setting, and our ability to joint venture on surgery centers with physicians is going to be critical to our success moving forward. It was referenced over in the Board of County Commission room that the ability to make strategic decisions in confidence is very important. Our ability to plan strategy without our competitors sitting in the boardroom, for any of you who've had a business or been in a business, know that that makes life quite difficult. As I said from the beginning, a strong Lee Health is important to a strong Lee County. So that's why we're asking you to help us on this journey and to provide the appropriate cooperation to make this happen. And that's why our Board of Directors on June 3rd, after 10 months of review, and you've heard the amount of review that was done, not only by our leadership team, by outside consultants, by meetings with the community, with our staff, with our physicians, they voted to proceed, and that the conversion is in the best interest of the Lee County residents. So with that, I'm going to ask our outside counsel, Ty Jackson, Jesse Neal, to come up and talk you through the mission agreement, the covenants, and the oversight monitoring. Thanks.
Good afternoon. Thank you all for having us. Thank you, commissioners. Thank you, staff. So in terms of the mission agreement, we were asked to, so we understand you all did not ask to be here. We understand that very well, but we need your help. The legislature, I was in some of those meetings with Michael as the legislature was looking at how do we do this, and I won't speak for them, but the impression I got was, why is it the county commission? Because you serve the same population that Lee Health serves today. And they thought, I think, that a group of elected individuals who serve the same population would know what's best for that population and best be able to oversee and enforce the commitments that would be made. So in terms of the mission agreement, the enabling legislation, you've seen this already, but I think it's important to see it again. Enforceable commitment that programs and services provided by Lee Memorial Health System will continue to be provided to residents of Lee County in perpetuity so long as the succeeding nonprofit entity is in operation, or if otherwise agreed to, until the succeeding nonprofit entity has otherwise met all obligations set forth in the agreement. The caveat at the end of that language was intended to allow the County Commission and Lee Health to have provisions in the agreement. This is an agreement that's intended to perpetuity, and you're going to need to be able to change things as times change. We have things today we didn't have 20 years ago, telehealth. You heard about acute care at home, where we're going to start providing acute level services in the home. Things like that are going to continue to happen, continue to change. It needs to be a necessary element of flexibility, obviously with the County Commission's agreement on those. So we worked with our board, with the Lee Health Board. You saw Mary walk through a lot of the background, a lot of the meetings. There was a lot of discussion on what does this agreement look like, and a couple of things that were guiding us. How do we make it as easy as possible on the county? Because again, we understand you didn't ask to be here. Easy on you operationally, as easy as possible on you financially. How do we have the oversight that's required by the legislation without burdening the county with operations and financial burden? So at the same time, the Lee Health Board very concerned about maintaining those commitments to the programs and services, maintaining the charity care, the nonprofit status, a commitment to Medicare and Medicaid for as long as those programs are something that are out there and available, and having local control. You heard from Dr. Not for sale, want to have local control. Which leads us to the first item, programs and services. And we're going to ask Dr. Antonucci to come back up because I'm a lawyer, I'm not a healthcare.
Yeah, this is a really important slide because it's important for us to acknowledge all the different things that we're doing and commit to continue to do those. So we worked with our leadership team, with our chief medical officer, our chief nursing officer, to come up with a list of services that we're providing so that we can continue to provide those and commit to continue to provide those into the future. And as they said, we also need flexibility because we know the world's going to change. The world's going to look very differently for all of us, but especially in the healthcare sector. But we believe that these are the services, the all-encompassing services that we will commit to continue to provide into the future. So I just wanted to comment on that and let you know that a lot of work went into creating this list. So thank you. We'll let you continue.
Doctor, I have a question. Doctor, thank you. I just want to make sure to clarify. Some of your doctors in the Gallisano Children's Service had contacted me before, but I was curious. Like, for example, will you still have a statement now, OBGYN? It must be stated in that to cover that. We talk about how many children we are delivered here in Lee County, a kindergarten class a day, which is unbelievable. But wouldn't it have to be that in the mission statement to cover that, so we make sure we continue to have that practice at the facility?
Well, that would be covered under women's health. Women's health is very wide, broad, and encompassing. We don't want to get too specific because if we get too specific, we're going to leave something out. Women's health includes obstetric and gynecologic care. It includes women's cancer care, women's heart care. It's all included in women's health.
I wasn't sure because I know some people think that they were concerned about that not being included because of liability for insurance. And that's something that drives the doctors out of the state of Florida because of that insurance coverage. So that's why I was questioning that.
No.
Make sure we have that. Okay, thank you.
Commissioner, to that question, your staff raised some of those same concerns. Why are certain things not in the list? And Dr. Antonucci, I hope, has covered that. In terms of OB, for example, births, there's data that shows how many births Lee Health is doing today. In the future, if there were to be a question, you could always look back at the data from this year, for example, and say, well, you were obviously providing, hundreds, if not thousands, of births in 2024. What's changed? Why is that different? Going next to the significant reimbursement change. So again, this is an agreement that's intended to live on in perpetuity. So a question was, how do you make this work into the future where the unknowns come into play? So there would be a process. The board obviously worked on this, and we put it together, got board. The way it's envisioned currently in the agreement, in the proposed agreement, is that there would be flexibility. So if there was a change, let's say, for example, we move to a single-payer system, or the government says there are no longer going to be supplemental payment programs, that could have an effect on Lee Health's operations 20 years down the road, 30 years down the road. First off, they would be required to do everything they could to mitigate that and continue to provide the programs and services. But if there were a change that so substantially affected the operations it was going to materially adversely impact the entity, they would be able to present that to essentially the county and say, hey, here's this change that's occurred. We'd like for that to be acknowledged as a significant reimbursement change to allow us to adjust as necessary. We've talked to staff about that, kind of that concept. This is one proposal, and if there are questions or issues, obviously those are up for discussion. Charity care, and I'm going to turn this over to Jesse to talk about charity care and how we came up with the proposed measure that we have.
Sure, thank you. Thank you, Ty. My name is Jesse Neal, and I'm a partner at Holland & Knight. And believe it or not, I spend almost all of my practice advising public hospital systems around the country in terms of evaluating and other structures that are available to it. And if there's one common theme in each of them is that if you've seen one, you've seen one. From the legislation to the list of services to the mission agreement with the county, they are narrowly tailored to the community. They're narrowly tailored to the hospital. They're narrowly tailored to the county almost always. And so with those guideposts, you develop what you think can, at base, track the legislation that has been developed and needs to pass muster. Two, it needs to track and be done in collaboration with the county and the county leadership. One of the biggest variables, if I can say so, in terms of hospitals finding strategic opportunities in the future to convert it almost always a huge factor input is how strong is the community economically, how strong is the community in terms of growth, intangibles like political leadership, civic leadership, in terms of evaluating a conversion and whether it's in the best interest of the citizens of the county. If you decide to take a step forward, in my experience, it almost always is a vote of confidence in the community and the community's leadership. So with the joint objective of a strong hospital system, this is not an arm's length transaction where you're trying to squeeze out of another. Both the county and the hospital want to have the strongest hospital system that they can. And one of the reasons for that, and in fact, a legal obligation of the hospital, is to serve the mission of the enterprise. They have a legal obligation, a fiduciary duty. It's enforceable, it's legal, it's real. They can't get away from it. To serve the mission of the hospital. And one important function of that is charity care to the community. And the IRS, as you can see, is very interested in this function when they grant 501c3 status. And the IRS has looked at different ways to calculate that, to assess that. They've considered a number of times about, should we have a specific dollar target? Should we have the potential taxes subject to? Should it be a percentage of revenue? Should it be a percentage of EBITDA? The IRS has consistently come back and said no. It should not be an objective hard standard. Some hospital systems out there in other parts of the world would use that as a safe harbor in effect, where you reach a certain threshold and you stop doing what you can for the community. The other reason is that there has to be, for a community, to maximize the value, to maximize the positive impact, is tailor-made to the community and its demographics, its growth, its background, its history. It has to be narrowly tailored to that. And so they have come up with a number of different flexible approaches to assess it. And in order to keep and maintain your 501c3 status, you have to maintain those IRS requirements as a baseline. What Lee Health, I think is fair to say, is proposing is that they do something more than that. There's a federal IRS threshold baseline. It's multi-factor, it's not a bright line test, but it's a baseline. On top of that, what Lee Health is proposing is that compared to other similarly situated public hospitals in the region, we'll do consistent with what they've been doing. And again, the challenge is not so much the aspiration, it's the language, drafting language that captures the concept. You look at historically what Lee Health has done, and you look at what they're intending to do. What's driving the review process is the mission. Loyalty to the mission, they have a maintaining the mission. In post-conversion, that duty to the mission stays in place. It doesn't go away. So they're still obligated to serve the mission. And how are they going to do that? There are going to be a number of different factors that hospitals will look to. And looking at other hospitals in the region, I've found, in my experience, to be a helpful way for the county and for the hospital to keep focused, keep some kind of analysis in place with regard to the charity care approach. So.
Now, I would just add to that, so the safety net providers in Florida. So there's a Safety Net Hospital Alliance of Florida. Lee Health is a member of that entity. We've listed the other organizations that are part of that entity here as well. For those of you familiar with some of these systems, you'll recognize those names as the providers that serve the underserved community. These are the providers that are out there taking care of the folks who can't afford the care or can't get the best. They can get the best through these providers, and Lee Health has been part of that alliance and would continue to be part of that alliance. And those are the entities that Lee Health is proposing Lee Health to be measured against going forward. So these, in my opinion, I think some of the best are in this list. Health certainly wants to continue to be in that same discussion and held to that same, as Jesse pointed out, higher standard than what the minimum threshold is. Again, this is the board's proposal. I know staff has had some about are there other measures or different ways to do this, and we certainly understand that.
I have a question for you. The Oversight Committee, we talked about that earlier. Has there been done anywhere else in the state of Florida? the oversight committee that's being proposed in this agreement? All these hospitals you speak of, do they have the oversight committee the way it's proposed in this current agreement? Is it been done anywhere else?
These hospitals do not have an to Mr. Smith's point, there's no similar oversight model that I'm aware of in the state of Florida.
How does Lee Health compare to the current proposed safety net providers suggested, that you're suggesting?
Mr. Natchep, do you want to take that, or do you want me to take it?
Thank you, Mr. Chair. So to the first point, that list represents a dichotomy of hospitals that are both public and private. So, for instance, Tampa General is a private nonprofit, Sarasota Memorial is public, UF Health, Shands University Partnership, Broward Health, public, Ascension, private, Nicollet, like it represents a bunch of different governance. What makes them safety net hospitals is the charity care that they deliver. And that standard looks different for all of them, but it's a mix of mostly Medicare, Medicaid, uncompensated care, and wholly charity care. For Lee Health, that number is around $179 million this year.
So my question was, so any other hospitals have the oversight committee to propose this current agreement that you were asking us to bring forward?
No, sir, not like this.
Thank you.
Thank you. And finally, and again, these are not all the issues in the agreement, but based on our discussions with the county, with your staff, there were a few that seemed to jump out. So the last one we'll really talk about is oversight. So again, we understand you didn't ask to be here. What we were trying to do is come up with a system that allows for that oversight by the county that's required by the agreement, but that doesn't create additional financial or operational burden on the county. The proposed idea, and I'm going to let Jesse talk about that because it's kind of his brainchild, so to speak, but is an oversight monitor. There are other options, auditors, but I'll let Jesse talk about the concept and how we got there.
Sure. Thank you, Ty. And welcome questions, but if there's a better example of you've seen one, I don't know of it. In terms of maintaining and documenting, affirming post-conversion compliance, in other states, in other regions, a oversight monitor was developed and was found to be a helpful function. I would tell you there's a couple kind of guiding principles in terms of how you document and affirm compliance. First and foremost, what's the easiest for the county? And then two, does it meet the baseline requirement in the enabling legislation? And I'd say those are the big factors. I'll tell you briefly, a third factor is in other regions I've seen where the county historically had significant control, oversight, involved in operations at the hospital. They appointed board members. They decided who was going to serve on what committees. They owned the real estate. They gave the real estate. They retained real estate rights in the hospital. And at the point of conversion, the question was to their constituents, to the public, if you're releasing these rights, these obligations that have been held for the public, what in return are we going to get and how are we going to document? And that's a very, very specific discussion around a community, a couple different stakeholders deciding we're foregoing this, we're getting that, and then the community saying, all right, we're comfortable with that. That's obviously very distinguishable from here, from Lee County. And so to the extent that the mission agreement that because it is a model that's out there that has worked. A hospital decided what was best for its community. They're successful. The monitor stayed out of the way. Their bond rating has gone up. They're finding success. To the extent that the facts are different for Lee County, the facts are different for the hospital, if the facts are different for the history between Lee County and Lee Memorial, then recalibrating that post-conversion oversight compliance frankly makes a lot of sense. And I'd say, on one end of the spectrum, in my experience, you have the county commission serving as a super board over the hospital system. I've found there are some cons associated with that. And on the other end of the spectrum, you would have either agreement to the public or perhaps to come in and document, comply, have credibility, professional qualifications, credibility, excuse me, and a lack of too much politics. That's not always the easiest thing to find, but that I've found has a lot of upside. Nothing has no downsides, but I've found that can be a helpful, productive model for a community if there's buy-in, if there's credibility, with all the other factors we're talking about. So maybe I'll stop there, but that's the target on the wall when we developed this for you and sent it over to you, which was, does it meet the enabling legislation's requirements, and what's the easiest for the county? And so I'm glad to pause there, pass it on to Ty.
I'll just touch on the last bullet point, community feedback and considerations. As you heard from Mary, there were a lot of community town halls and other opportunities for the community to provide feedback. I think the community's reaction to this was generally positive, having an independent entity that has representation locally that's ultimately, the county commission ultimately is responsible, but this oversight monitor would do the day-to-day regular oversight of the operations and requirements under the, not operations, but the requirements under the agreement.
I have a question. I'm sorry, Ty, I have a question. You said the county commission would be involved?
Well, the county commission is ultimately responsible for the oversight. With this, the oversight monitor concept, that entity would, on a day-to-day basis, oversee the enforceable commitments in the agreement. There are certain times when that entity might need to go to the county for certain decisions. Certainly, it would report back to the county as to what the status is of the enforceable commitments. Are they being complied with?
Based upon what I've been briefed with staff was before this meeting today was there's loss of sunshine in these committees, correct?
I'm sorry?
These committees will not operate under sunshine, correct? Sunshine, Florida Sunshine Law?
I don't know that that's, so this would be a separate 501c4 entity, standalone entity. It would not be a committee of the hospital. It would be a separate 501c4 entity. There's portions of that, as an attorney that deals with public entities, I think there are portions of that entity's activities, certainly when they're reporting back to you, those would be subject to public records.
So that's why I was asking, because next to public records, once it comes in our world here, from that world, it's public record.
Of course.
So when I spoke to our council last about it, it was there's no loss of sunshine, obviously loss of public record, the board membership, so you say that how would it come back to the county commission to review or enforce? We don't have an enforcing agency here to do that. So that's why the confusion. We've had a year and a half to prepare for this and look at this, and that's why I have a question about this. So while we take that right from the voters who now currently vote their assets, the current board of directors of the hospital, and take those assets and put it under something that's not under sunshine, not loss of public records. So maybe my staff can answer something on that. Richard, can you? Because we were told that we wouldn't come under public record, would not come under sunshine. These people will not, these committees will not come under that.
Yeah, Richard, go ahead. The implication of the Sunshine Law and the Public Records Act was discussed heavily amongst the staffs in the preceding 2 weeks that we've had to work on this agreement. The discussion was had with regard to if we were going to have an oversight committee as to whether that committee would operate in the sunshine and or public records. And it's our office's opinion that if that is a committee established by the Board of County Commissioners, they would be operating in the sunshine. Okay. The question then shifted to, do we want a committee or do we want an oversight monitor? And if we go with the oversight monitor model, what are the duties and responsibilities of that monitor? Is it on a day-to-day basis? Is it on an annual certification process to the Board of County Commissioners? But the oversight issue was one that remains open amongst your staff and the representatives of Lee Memorial.
In the board membership, how would that be composed of?
The board membership for the hospital system, that would convert to a private selection system. It would no longer be by public vote.
And just for full disclosure, do we have the total liability from the county? I know you've been working on this for a few weeks. Do we have the liability to the county based upon the current agreement that you have in hand?
No, sir.
We don't know the liability back to the county.
We've been assured that there would not be any financial liabilities flowing back to the county, which is provided for in the statute. That then begged the question of, for outstanding liabilities to third-party creditors, we would like to see some type of assurance from those creditors that they would agree to the transfer, whether that be in the form of an affirmation by Lee Memorial or by the individual secured creditors. That was an issue that remains open and outstanding. But it was the representations of the hospital system that there would not be any assets or liabilities transferred to the county.
Do we have a schedule? We have a schedule of all the assets now? Any assets? Do we have all the assets?
No, sir.
Under Lee Health?
No, sir.
You don't have that. Do we have a timeline for the life agreement? Because we're hearing today it would be no health service tax in the future. But if the agreement expired, they could ask the county to impose a health service tax for the community, correct?
Again, Commissioner, that was the duration of the agreement was an issue that remains open for discussion between the two parties. That was a specific concern raised by staff that we believed it would be the position of the Board of County Commissioners that should this conversion go forward, we would need a covenant and commitment from Lee Health that they would not seek future funding options from the Board of County Commissioners. Obviously, in order to make that commitment binding in perpetuity, the agreement would have to be in perpetuity.
Okay, just for disclosure, I have to leave soon. I have people waiting since my 11 o'clock meeting in my office this morning, so and I got community people coming in at 2. One more question. Do you have any concerns based upon the agreement you have before you now for the Board of County Commissioners in the future of the county?
Yes, in the sense that the agreement is not finalized. There are several major issues that remain outstanding that we require direction from the Board of County Commissioners, as well as Lee Memorial staff pointed out in our meetings that any discussions we had with regard to modifications or amendments to the agreement we were presented with would have to go back to their board for discussion and ratification. So we do not have a meeting of the minds at this point in time.
Okay, thank you.
Thank you, Mr. Chairman.
Thank you. I'll turn it back over to Dr. Antonucci.
Thank you all. Thank you for your indulgence. I know this was a long day and a long afternoon, but we wanted you to make sure that you understood where we were coming from, the journey that we've been on, and the due diligence that we've undertaken, and the transparency with which we've gone through this process. As I mentioned, Lee Health is not for sale. We have been completely transparent in everything we've done along this process. Everything is posted on our website, including the Kaufman Hall report. We commit to being bound to safety net care in perpetuity. We will not shift any liabilities to Lee County government or its residents. We will not have taxing authority, as we do not have taxing authority now, and we do not want to place any financial burden on Lee County government. As I mentioned, for us, it's about continuing to be what we've been for 100 years. And sometimes if you want things to stay the way they are, things have to change. So thank you again. This is our website, leehealth.org/lookingahead. It's updated frequently. All of our materials are on it. There's a place for questions. If you have questions, if your constituents have questions, please ask them to submit them. And there are, in addition, some frequently asked questions on there. So again, thank you so much, and look forward to any further discussion. Thank you.
Glenn, you have one more slide you want to present. Is that correct?
Mr. Chair, we do have one more slide. I think we can move through it really quickly given some of the conversation that just transpired. Mike, can you put that up for us? It has to be done from the, okay. I'll just, while we're pulling it up, we just wanted to reiterate that we do need some direction from the board with respect to a conversion agreement. If the direction is to move forward, programs and services, you saw that delineated today. Is that the right level of specificity that the board is comfortable with? Do we need to specify levels of service beyond what was proposed? And crucially, what is the term of the agreement? Is it in perpetuity or for some other time frame? On the monitoring and oversight function, you heard the proposal. How would that committee be structured? What is its governance? Does it monitor on a day-to-day basis or something other than that? Staff would be interested in exploring with the board an alternative process whereby perhaps an independent auditor with relative expertise would certify compliance with the agreement's covenants on a periodic basis. But that's something we need to discuss with all of you. In terms of enforcement, is there something beyond suing for injunctive relief or monetary damages that the board wants to see? Commissioner Pendergrass, you mentioned an enforcement authority. We would need to explore what kind of enforcement mechanisms the board might want to have. And then with respect to additional issues, you all received an annotated agreement that Craig had worked on that flagged a number of open issues that the county attorney referenced earlier, one of which would be what kind of built-in flexibility should this agreement have, meaning the landscape of healthcare is changing dramatically and will continue over time. So do we need built-in mechanisms for modifying the agreement, or does it need to be amended by the parties coming together every time an instance arises where change is necessary? And so there's just a number of things that staff needs board guidance on here.
I'd like to open the floor to the commissioners and staff to discuss openly now where you're looking for direction, and I'm not sure we're prepared to give you direction. And I'll go ahead first. I guess our biggest concern is we're being asked as county commissioners to make a decision that will affect Lee County residents forever in an awful short period of time. If we don't have a package sitting in front of us that is negotiated completely, that we can look at and go and make that decision, that I guess I'm not comfortable making a decision on something that isn't complete or open. So, I know we need to move forward. I think the timeline is a little crazy in 45 days that we're going to have an agreement that we have to make a decision on to move forward, and that's our timeline, and we don't have a choice. And I guess one of my questions right away would be, if we wanted to get a little more time, it has to start all over again. Could you explain that to me, please? Sure. Mr. County Attorney, please. Thank you.
As we discussed, and could we put the slide back up? That might help with the timeline. Is that doable? As we discussed at the beginning of the meeting, while the slide is coming up, the difficulty we have as your staff is operating on this significant project within the time constraints set forth in the statute. We talked about the 180 days, the 120 days, and then the 45 days. We actually have to have an agreement negotiated and acceptable to the parties by August 17th so that we can publish that agreement. The difficulty from the county's perspective that I perceive is this is a workshop, and consistent with your workshop procedures, you're not permitted to take motions or take formal motions and second and provide direction to staff. In keeping with your policies, whatever the fruits of this workshop would ripen into would then have to be codified by staff for an agenda item to be presented at your August 6th meeting. That would give staff and Lee Health from August 6th to the 17th to come to an agreement that would then be published. Those are the timelines we're operating under. That agreement would then be published for the 45-day time period. The special meeting would be on October 8th, and in that intervening period, hopefully Lee Health would approve the agreement. But we would need the draft conversion agreement as shown by August 17th with these significant issues resolved so that the Board of County Commissioners, at a minimum, not speaking on behalf of Lee Health, would feel comfortable publishing that draft agreement to meet the 45-day time frame. Now, having said that, I would remind you also again that we do not believe the legislation as currently drafted limits the number of times either body can go through this process. I know that's not necessarily desirable by Lee Health, but it may be a reality to getting what you all have identified as a significant community issue that's going to have significant community impact in perpetuity for the people of Lee County, done in basically a 3-week time period.
Michael, go ahead, Ed.
Thank you, Mr. Chairman. Just if I may, that the deadline's not August 17th, it's August 27th. You can have a meeting on August 20th. You can have a second meeting. So August 6th, you all would have a regularly scheduled meeting. August 8th, the Lee Health Board of Directors would have a meeting. August 20th, you all would have a meeting. August 20, looking to my team, where we would have a meeting right after that to be able to codify whatever is done there. So 2 meetings in August, final posting by August 27th to hit an October 11th deadline, but you would have to schedule an October 8th Board of County Commissioners special meeting to fit within that. So 2 meetings in August.
So again, I'll step back and say that at this point, we don't really have all the answers that I think we need. And if we're talking about August the 6th, we're literally talking how many business days, you know? So very few business days to get to a point to where we can see our liabilities, how we move forward as a board, what our oversight is, what you know, actually what we could do to remedy any issues that would come forward into us in the future. So I'll just throw that out there, but I believe the conversion is maybe the right thing for Lee County, but my concern is the timeline of making this crucial decision on 5 people that don't have the information fully in front of them. I'm just very concerned about that, Michael. Please, go ahead.
Thank you, Mr. Chairman. Just, if I may, I think it might help if council possibly opined on how many outstanding issues between the mission agreement that Lee Health had submitted and the suggested revisions that county staff had made are outstanding. I think if you may see the discrepancies there and what issues are outstanding, you might feel a little bit more comfortable about the distance we have to go.
All right. Commissioner Wayne.
So I basically are trying to understand the open items on this. That's really what I'm trying to get to, okay? I respect the fact of the time frame, and first and foremost, thank you for all the information. Really helpful, and honestly, as a resident of Lee County that has been involved since the day I got here, I want to continue to make sure we are. And I use your facilities and want to see you prosper and move forward and meet all the challenges you have. I think the challenge we have here today is trying to make sure, when I come from the conversion world, having done this in the private sector, there's obviously a list of things that are open. I'm looking to see a particular list of what's open, whether it's an agreement, obviously codifying what our hold harmless might be or anything of that nature, from what liabilities and assets, trying to understand the forecast a little bit better. And I saw some of your models, but charts are great. As an accountant, I like financials. I really want to kind of peel that back as deep as I can. So having purchased and or sold companies in my private life, I'm just trying to look at something similar to understand a document. And here's the 8 things that are open. To Michael's point, I think it's important for us to understand it. I'm also going to say that I've worked into this agreement in this environment where we've had a list of open items. We all understand that, with an understanding that we need to achieve answers to all those items that are satisfactory to both sides. That's basically the premise I'd like to go underneath. So if we can have staff, and the other issue that I'm not used to in this environment is in the private sector, we go out and hire a team that represents either I'm a buyer or a seller. So with the exception of staff, what other outside people are assisting staff in this endeavor?
Yes, Commissioner.
Chairman, at this point in time, it's our outside counsel. That's all, because part of the difficulties we ran into is, given the short time frames, any outside consultants would have to go through our procurement process. Our procurement process, at a minimum, takes 4 months on an expedited basis and 6 months on a typical basis. So the only outside expert we were able to bring in to assist us within this time frame is outside counsel, because fortunately outside counsel is beyond the scope of our procurement ordinance.
Yes, sir. Commissioner Ryan.
I appreciate your response, which I really do. I'm just trying to understand, and you gave me great insight, just trying to understand what our open item lists are, and what is, I think the chairman's indicating is that the first time we're together as a group, where on the reverse side, Lee Health has had an opportunity to continue to bring their board, their group, their process. I mean, it seems a year for you all and 45 days for us, or whatever the time frame might necessarily be between now and even October 8th. It's about 70 days. Again, I'm open to moving forward, provided that we understand what the open list is, and if it's feasible and acceptable by staff, that we can get to satisfactory answers. Because I'm going to assume, even if we have an agreement that our counsel has certainly given his feedback on, he's obviously made those suggested changes with outside counsel, and we sent them back to you all. I'm assuming you got to go through those, and your staff's going to go through that, your outside staff or inside staff, and then you're going to go to your board with this is what Lee County's looking for. So I'm just really trying to understand what is required, the time frame as we go through a really accelerated time frame, and I want to make sure we achieve the objectives. I've watched major companies in the private sector move at lightning speed. I've never been in this situation in the public sector with the restraints that Richard just alluded to. I'm confident that we can do something because we've done everything together. So nothing is not achievable. It's just that I'm just trying to understand what that is. Let's understand we have 5 open items, and again, as an accountant, yeah, I want to see assets and liabilities. I want to understand how your dip goes down in 28, how it comes back. How do we help? And as someone that obviously has roots here, has family here, I want to make sure we can make these decisions, and I am nothing other than supportive of having a strong Lee County for all our residents. Thank you.
And just to follow up on that, I feel this. I think the board's in the same mindset. Is that we just need to make a decision on something that is definite, that we can live by, and I think we're not there yet. But we have some time. I granted we have time, and I want that time to be explained a little bit more to me right now. Is that if we give recommendation today to continue to work on it and bring it forward for next week, then when would we see that? When would we? And if we do move it to that point, do we have time in between that? Sounds like at the 20th, if I'm right, Michael. At that point, the agreement would have to be ironclad, I guess, right? Is that right?
Yes, Mr. Chairman. The published date's the 27th. The 20th would be your last public meeting where you'd have an opportunity to take action unless you schedule.
The 27th, it would move to the 27th. Okay. I just wanted to make sure that was on record. Commissioner Pendergrass.
A question about County Attorney. County Attorney, we heard today from the hospital, obviously even from their members of public speaking, I think one of the restraints is economically they're not been able to expand, and we all know the history of that. We all know, like in 2020, Representative Rodriguez tried to get the bill, and we all have been supportive over the last 10 years of the hospital expansion. Is there another way this statutory could be changed, this current provision agreement, where they could do that? Does the state change the provisions to allow them to do business outside the county without having to go put all the burden back on Lee County?
Yes, in the sense that if you can get the legislature to approve that, yes, that if that's the major outstanding issue is being able to operate beyond the territorial limits of Lee County, that is an easy right in the sense of that's probably 2 lines to the special act and strike the balance of this. Whether that would now be amenable to the legislature, who knows what the legislature does in session. But I do think it's interesting to observe that if this board would make that recommendation or support that type of endeavor, perhaps it would have a different opinion within the legislature as to how they're going to treat Lee Health going forward. And by that I mean, if the legislature is made aware of the Board of County Commissioners concerned about their role in the legislation as it currently exists, then perhaps they would be more amenable to extending the boundaries of Lee Health's responsibilities beyond Lee County.
Michael, going back historically, it's the past now, 2020. We all remember the hospital trying to expand South Lee County. What was the nature or the feeling of the House in 2020? Why they wouldn't accept that and let you guys expand across the boundaries? I mean, we're very frustrated about that too, just like you were, I'm sure. What was the sense of the purpose of them not allowing that, and why would they allow that today? Because this special agreement would allow that. So why would this allow that special act to be changed to that?
Thank you for asking, Commissioner. So the legislature has moved in a direction over the last few years from that initial request. This is the local bill process is driven by the House, right? Not the Senate. Local bills originate in the House. There are 3 committees of jurisdiction in the House of Representatives that maintain the public policy control of these issues. The majority of them fall under independent special districts, of which there are roughly 2,000 in the state, but there are 28 public hospital districts. Each of them originated in different ways, some created by referendums by their communities, many created by the legislature. The legislature sought in their discovery a number of different ways for doing this, and what they lean back on is something that they had allowed with Tampa General in 1997. The purview of what we had asked for was to expand the geographical territory initially. Their thinking evolved, and ours evolved along with them, because they showed us the policy direction that they were willing to drive, and we worked with them to get that done.
Mr. Harner, you're recognized.
Thank you, Mr. Chair. As I see it right now, we have 2 options on the table, and I'd like to discuss both of those. I think the first option is, as it's been stated, is we go back and discuss this a little more with Lee Health. The second would be to let the legislature know that we have concerns with county involvement. On the first issue, I think we can go back and talk, but the prevailing issues that we need to address, and Glenn, help me here if I hit the ditch, but the prevailing issues that we're going to need some input from the board is regarding the monitoring component and the enforcement component. We've touched on those today. The monitoring piece could be addressed, but the enforcement issue is a little bit harder for us to move forward, because ultimately there's a number of options you could use. You could mainly file a lawsuit, and I don't think that's where anybody wants to go in this process. We could do like we have in other agreements, and we could have a liquidated damages associated with that. But again, more than likely going to go into court. And then the third option is potentially a trust fund. A trust fund could be established. But then again, you have to have provisions of when that trust fund's triggered, and then potentially you'd end up in court. So ultimately, those 3 options are the enforcement component that we have. That is not something that we can discuss as 2 parties working on that and come up with a finite solution. I think that would involve board discussion. And ultimately, I think not that, and another area that we probably could not come up with any clear resolution is, regardless of where we stand liability-wise, a few of you mentioned to me the concern of how is Lee County going to look regarding any Lee Health decisions. We aren't liable with any Lee Health decisions, but that doesn't eliminate the concern that you have that potentially people will show up to a board meeting to voice their concerns regarding Lee Health because you are involved. And then potentially we could be named in a lawsuit, which more than likely I think we're comfortable, we'd probably prevail, but still, it's still the fact that you could be in a lawsuit and you would have to defend that lawsuit. So those are areas that I don't think we're going to be able to discuss if we, in another week. We would still have to come back and have those answers from the board.
Commissioner Sandell.
brain is full. First of all, I absolutely believe in the conversion. I've done a lot of reading, as all of us have, a lot of information, tried to put that. Fortunately, also, we have a number of doctors in our family. I've talked to them personally. I've talked to them, about a number of different options. It's interesting, too, because I think what we're trying to get to with my brother-in-law's a doctor, and he said it all comes down to the doctor and the patient. And I think for me, that's the goal. What is the best situation for a doctor and patient to interact? Thank you to Lee Health. If we've used their services, myself and my wife, I'm here to, as an example, that it works. So I'm a huge fan. I think we talk about our school systems. We talk a lot about different things. I think we want to make sure that we as a health system are in that top tier. That's an important component to who we are overall. We talked about the parties involved. I think the legislature put a framework in place that Lee Health, if I understand it correctly, had to respond to. So they're a part of the box that we're kind of in. So they set the parameters. Lee Health stepped it. They went in, and then we're kind of at the tail end trying to pull the pieces together, as you said. And it's really a matter of time. I think it's a matter of time, but I think it's also a matter for us to get the right kind of guidance to make the right decisions to do this. I'm very concerned that we can do that in the short time frame that we can. As Kevin said, nothing's impossible, but there's a practicality of what we can get done in a finite matter of time, and be comfortable with that.
I would give direction to the board, to staff, that we move forward, but we move forward under the assumption that we're going to have to get something in front of us that we can agree on, that we could vote on. And I don't think we're there yet. And I'm concerned at time, and I'm being honest. I think you guys are a wonderful asset to Lee County, and I want to make sure you continue to do that. And I just want to, I know I want to make sure that I feel comfortable that I'm making the right decision. And I need more in front of me to do that. So,
Question.
Yes.
I see staff's been doing a lot of work, obviously, behind the scenes. How much do you think Lee County has got to invest so much in this project? We have any estimate of hours, of thousands of hours, outside counsel and outside, and now I see meetings, special meetings. There's a cost incurred to that, correct? Is that, Dave, could you answer that, or Rod? Richard?
Outside counsel is being reimbursed through Lee Health. I do not have a number for the hours that we spend.
I'm just looking back, all these special meetings, all this extra work being the burden put on staff, is costing Lee County taxpayers money, could have been avoided if this stuff would have been scheduled earlier, correct? We would have had time to have more workshops, questions, a rough draft brought before us, advertised properly, not rushed through, walk-on items. It just doesn't look good. The transparency looks really bad. So, and for behalf of us, that's taking this liability, and also for Lee Health, I want to protect Lee Health, I want to protect us. It doesn't look good when we're doing it like this, and that's my concern.
So what flexibility, if any, do we have, the state legislature, to expand this timeline? Maybe we don't. But as I said, I think we started with that box that was created originally, which Lee Health had to, and look, I came from the private sector too. Time is money, and time is however you want to spend it or look at that. I want to make sure, and the competition continues every day to compete against them. So time is sensitive for Lee Health in getting this done. Cecil, I liked your pops. What's the biggest issue, and can we expand that? But I think getting to the legislature today, tomorrow, you'll find out what flexibility they have in helping us to get a time element that gives us some of the answers we had would be, I think, prudent.
Anyone else? Commissioner Ronnie?
Sure. Thank you. So, County Manager, I heard you give direction. I'm curious if, the board would consider, let's continue in the spirit of this to move forward. And if we can have by the 6th a list of the open items and identify where they are and, whether that's monitoring, oversight, or enforcement or other issues. So we have at least a chart of, okay, here's what we need to accomplish, and here are the open items. I'm trying to just come up with a timeline in my head and trying to understand the open issues and how do we get the answers that we need, and maybe other additional issues. I think what Commissioner Pendergrass was alluding to is how much time we spend in this, and at the end of the day, my understanding is that our time and or expense is certainly going to be reimbursed to us. So I just want to make sure we're doing what we can do. Does that sound like a reasonable approach to what we're
Absolutely. I think that's where I'm trying to get as well, is that we want to give opportunity to continue to get there. Let's get there if we can get there, right? That's my recommendation. Basically, I think what you're saying is we have some days here, but we need to be comfortable that what we're voting on is right, and it's right for our, the constituents that voted us in, and we all have that obligation. So that's my recommendation. I think it's basically, I think we're on the same page.
I'd like to take a run at it and see how much we can get done. I have my concerns like you do that we can.
Right.
But I don't want to be a lack of trying.
Right. And I don't want to shut something down that I'm not trying to shut it down. I'm just trying to get to the right place. And I think that's important for all of us and everybody we represent. So that's my direction. Anybody else? I think Kevin.
Does that seem like a reasonable approach, County Manager?
Yes. Yeah, I would like you to please.
Yeah, if we could lay out the items that are open and give us an understanding of what those items may be, and at least have an understanding so when we get briefed for this, we at least have some more clarity. Right now, there's a lot of ambiguity.
Yes, we can provide the open items. Again, the issues I brought forward, at that point, the board would need to give us direction on those issues. But yes, we can work with them in the next week, be able to put together a blue sheet with those outstanding items and any potential fixes or recommendations, and then additional direction from the board.
Follow-up for our county attorney. Is there anything that would preclude you from sharing with the board what agreement has been sent in draft and what issues are open?
Mr. Chairman? No, absolutely not. And we would happy to send that out. The latest proposed revised draft that has a red line, proposed changes as recommended by your staff. And we distribute that this afternoon.
Thank you. Follow up, Mr. Chair.
Yes, sir. Please, Commissioner.
So, if we can, I think there's an understanding here that let's move forward. I think there's an understanding of let's come up with a list that's obviously outstanding and identify those and see what county staff can do to fill in those items, whether it's a draft or agreement or anything else. And as we have other thoughts that come up as county commissioners, we could convey them to county manager and county attorney, and they can convey them to you. I just want to continue to move the ball. And we may come to a point where we could put it in the end zone. We may come to a point where we fumble. I don't know. But I think you've all worked real hard on this, and I want to continue to understand what are obstacles and what potential solutions may or may not be there. If that's fair with everybody, I think that should be direction.
You have everything you need, Mr. County Manager?
Yes, I do. Thank you.
Okay. All right. Any further business in front of us? We are adjourned.